Now, Your Excellencies, ladies and gentlemen, we have the great privilege and honor to also invite Professor Viviene Taylor to come to the fore. Now, Professor Taylor teaches social policy, development planning, and social and economic development in the Department of Social Development at the University of Cape Town. Professor Taylor's career consists of both national and international development experience spanning more than 30 years. She has researched a lot and she has written numerous publications, including 3 books. Now, from the side of the AU, I can just also mention that up to 2008, we worked very closely with Professor Taylor on the social policy framework for Africa. And that's what I said. That's why we said we want you here today. So thank you very much, Professor Taylor. We are looking forward to your presentation. Thanks.
Thank you very much, Chairperson, Mr. Johan Strydom, His Excellency the Ambassador, Dr. Aidu, who said much of what I was already going to say, and distinguished delegates. It is indeed a privilege to be here to address you on a matter that is very close to all our hearts. I want to begin by talking about, very briefly, Africa's socio-economic context, its demographic challenges, as well as its place in the global system, because it is these issues that prompt us to provide a renewed urgency to review lessons of experience in social protection and to maintain and expand an agenda that introduces both strategic and practical measures to address poverty, vulnerability, and risk, especially in relation to children. Now, Dr. Johan Strydom has already mentioned 2008. In 2008, in preparation for the AU meeting of Ministers of Social Development, we noted significant shifts in thinking within Africa and elsewhere in the world on how social protection is understood, its links to sustainable economic development, and indeed equitable development, and its relevance as a comprehensive response to poverty and capability deprivations. Such shifts are a move away from an incremental, piecemeal, safety net or residual welfare approach to poverty. Social protection today is understood as a comprehensive developmental policy that is seen as a necessary component of growth with human development and equity. This shift in our understanding of social protection reinforces why we need to expand a rights-based approach to social protection in the region. We find that countries in Africa that have introduced social protection programs point to the protective, the generative, and developmental functions of these programs. Compelling research findings on government-led social protection programs tell us that countries with strong social protection programs are better able to withstand economic and human insecurity, especially in times of financial crises. Today we know and we recognize that social protection is both necessary for sustained human development and sustained economic growth. Importantly, studies undertaken in calculating the costs of basic social protection measures show that these are affordable in low-income countries in Africa. Research evidence also confirms that when social protection is located as a critical component of social policy and development, it has the potential to address multiple dimensions of poverty, to reduce inequities and inequalities, and to play a role in the national economic growth agenda. Now, what we find is that a key policy consideration related to such shifts in thinking is not whether countries should have social protection programs, but rather how to promote social protection to ensure it generates human development and inclusive economic growth alongside human rights. Strategic and deliberate policy choices are on the policy agenda of many governments in Africa on social protection. Issues on the social protection agenda today focus on what provisions should constitute the basic package of social protection, who should be receiving such benefits, how to determine and benchmark the level at which provisions are made, what instruments would be required to monitor and evaluate the impact of social protection programs, what are the distributional impacts of benefits, how do governments build capacity for implementation at national, local, and sub-regional levels. These and other questions are an important part of the strategic social protection agenda in Africa. As His Excellency the Ambassador said, there must be synergy between social protection and child protection in Africa. We need to also ask why we should promote an agenda for social protection and not a social safety net, as is often mooted. We are saying in Africa, countries with both chronic mass-based poverty and large social deficits require more active social protection systems that reduce poverty, contribute to asset redistribution, and that include measures to address the structural basis of poverty and social exclusion. Social safety nets are ameliorative and usually provide temporary relief without dealing with the root causes of poverty and its multiple deprivations. And that's why we need social protection rather than just social safety nets. Typically, social protection measures include cash transfers, such as pensions for the elderly, grants to children and households, cash for food, and public works programs. In its more comprehensive role, which is what South Africa is trying to achieve, social protection measures include access to nutrition, to health care, housing and education. Social protection can consist of a range of measures that offers support to all citizens and helps individuals, households, and communities to better manage risks and actively participate in all spheres of life. Using a mix of socially protective and development-enhancing measures as a basis provides governments with the building blocks to address the demographic, social, and economic challenges in Africa. Dr. Aidu has already elaborated on the demographic challenges and on the socio and economic trends in Africa, so I will not go into those. But what I do want to reinforce is that we are in a crisis when it comes to how we respond to some of these demographic challenges and the social and economic trends. What we find in Africa is that many dimensions of well-being, such as health, education, and income together give people the building blocks that enable them to get out of poverty and to utilize economic and social opportunities to promote individual and collective development. Thank you. A multidimensional approach to poverty, one that includes a mix of social protection measures, fits well with a freedom-centered approach to development as articulated by Professor Amartya Sen. These dimensions include aspects of living standards, such as decent waged work, literacy or schooling, and health, measured by life expectancy, infant and maternal mortality. Among the many different categories of people living in poverty, it is children and women who are disproportionately affected. We also find age, gender, spatial, income and work-related vulnerabilities combined with other conditions to leave especially poor children in Africa in acute social and economic distress. Unquestionably, in this context, the needs and rights of children must be a priority. Exclusion from social and economic processes in the form of access to health care and education, food, waged work, and income contribute directly to the multidimensional poverty by being experienced by over 55% of Africa's population. Consensus is strong that access to health care and basic education, together with income from decent waged work, form key components of a social protection floor. Providing health care and education, as well as an enabling environment for decent work, is today recognized as the responsibility of national governments. It is also importantly recognized by the international community that governments can do this if there is an international policy regime that protects and promotes the human rights of all while prioritizing those who are the poorest and most vulnerable, that is, children. Unnecessary human suffering and premature loss of life violate basic human rights, retard human development, and waste human potential. Yet notable interventions are being made in countries in Africa. Take South Africa as an example. 2 decades after the democratic government came into power, the country has made significant progress in achieving the rights embedded in the South African Constitution, and especially in Chapter 2 of the Bill of Rights. Together with the Constitution, a major policy instrument for the improvement of children in South Africa is the White Paper for Social Welfare of 1997, which provides for the provision of social protection and developmental welfare services for all. To give effect to the social security rights, the Social Assistance Act number 13 of 2004 was passed after extensive review of social security arrangements in the country. This act makes provision for children living in poverty through the Child Support Grant, the Foster Care Grant, and the Care Dependency Grant. The Children's Act, as amended by the Children's Amendment Act, Act number 41 of 2007, also sets out principles related to the care and protection of children. Some of the most important principles include early childhood development and compulsory primary education. The National Health Act number 6 of 2003 ensures access to free primary health care and in particular free health care to pregnant women and children younger than 6 years old. Together with the National Development Plan, South Africa today has a long-term strategic agenda on how to advance the human rights of its children within a social protection framework. Now, I'm not going to go much deeper into South Africa's social grants. Believe me that I can spend the whole morning with you talking about this issue and where we've come from and its significance in reducing poverty. But what I do want to focus on is that when we started making reforms to our policy frameworks and to our programs, by 2002, 80% of our children, or 14.3 million children, aged 0 to 17 years old, lived below a poverty line of 490 rand. Today, with the policy reforms and the program reforms that South Africa instituted, 11 million children benefit from the child support grant, and another 500,000 benefit from foster care grants. As the Minister shared with you last night, by February 2014, there were close to 16 million people benefiting from government cash transfers, and quite a few are benefiting from a comprehensive package of social reforms in terms of health care and education. However, because of the depth of poverty, such interventions do not remove children from poverty and multiple deprivations. This is why it is important for us in South Africa and us in Africa to focus on a mix of measures or on comprehensive social protection that include early childhood development, access to free primary education, access to essential health care. Importantly, as the first speaker in the session said, social welfare services for the psychosocial needs of children, nutrition, housing, safe neighborhoods and communities to protect children from the abuse and violence that they experience, basic social services and basic sanitation. These are not what we should be doing, these are what we must provide if we want to see improvements in the well-being of all our children. Before I conclude, Chair, I want to share with the audience here this morning the importance of starting off with social cash transfers in South Africa as an intervention to address income poverty. Because quite often we hear the argument that cash transfers create dependency and act as a disincentive to markets, to economic markets. What we have found in South Africa and in countries where such interventions have been introduced is that there are generative or developmental potentials to cash transfers. In countries that have introduced unconditional cash transfers or even conditional cash transfers, significant impacts are made in reducing destitution and deprivation of the poorest, as well as in increasing levels of consumption and economic productivity. The local economic activity in increased consumption patterns leads to positive economic and social returns. There are multiplier effects through local cash circulation. Although these effects are limited by high transaction and administrative costs in South Africa. Reynolds found in 2005, that's Norman Reynolds, an economic development expert, found in 2005 that the benefit or multiplier effect on the local economy of 60 billion rand paid to grant recipients was 78 billion rand. He argued at the time in 2005 that if cash transfers were part of other measures, including decent work for non-working, economically active, poor individuals, the multiplier effect could be 4 times higher than it was, or as much as 240 billion rand. We know that cash transfers do help in other ways as well. In South Africa, we find that it's helped those who are affected by HIV and AIDS and other debilitating diseases. Evidence has also shown that cash transfers contribute to reducing both gender-based inequalities as well as income inequalities. I want to conclude by saying that when focusing on the challenge of adopting a rights-based, pro-poor social protection agenda, there are 3 processes which are important. And this is what we've learned not only from South Africa's experience, but from other experiences elsewhere in the world. The first process is that we should begin with the review and revision of our official understanding and definition of social protection so that it is understood across all government departments, across civil society and business sectors. The second process is the development of a collective vision for reform of social protection. It is useless only one part of the social groupings in a country understanding what the reform process envisages. All partners need to be aware of this. So there needs to be a collective vision for reform of social protection, including strategic objectives that prioritize the rights of the poor and especially of children and the vulnerable. The third process is to agree to the values, principles, and norms or standards against which strategic objectives in each country can be benchmarked. These processes, together with the political will and the institutional capabilities, can deliver much more on the social and economic agendas for the rights of children and the rights of human development on our continent. Thank you.
Thank you very much, Professor Taylor. You were the third big boat that broke the ice for us, and we will all follow in the course of the next 3 years. The next 2 days, sorry. 3 years, yes, let's say 3 years. Anyway, let's put ourselves a target there. Thank you very much, Professor Taylor.